to do your opening.
Okay.
So I apologize. The person who was going to be welcoming Kathy was struck with a migraine this morning. So she is unable to be with us. So you're stuck with me. And I just wanted to thank you everyone for joining us and do a few words before we introduce Kathy. I asked if you could stay muted during her presentation. There'll be time for questions after her her talk, and but if you want to put a question in the chat, we will keep track of those to ask Kathy near the end. I also want to highlight some other upcoming events. We have a few virtual programs happening, and I already put the links in the chat if you want to check them out. We are doing holiday cards from home this year. So we're going to be creating packets of cards for people to address from home to our alumni who have been out of school 50 years and back. This is usually an event that we have here at Alumni House, and it's kind of a treasured tradition. So if you'd like to do cards from home, we just need you to RSVP. Another event is we are having our annual meeting, which we had to postpone from June, which is another important event that we have every year, and we're going to be doing it on Zoom December 5th. So you can RSVP for that also. There's a link in the chat, and Kathy will be one of our speakers that day. And then lastly, if we skip forward to January, our next Coffee and Conversations in the series will be on January 26th, I believe, and that is going to feature our own Debbie Cleveland. So yes, she'll be talking about A Woman's Ways and Means, which she co-wrote with State Rep Barbara Gray, and talking about all that she did in the community. So very interesting stuff. So without further ado, I just want to welcome Kathy Hursen. And Kathy is a 1998 graduate of Framingham State and has 30 years experience in public health and outbreak control. She has done numerous presentations, including one for IASPA in November of last year about the 1918 flu. We didn't know then how timely it would be. She is our first repeat presenter because the topic is so timely and interesting. So thank you, Kathy. And
Thank you.
I will turn it over to you.
Okay. Okay, great. Come on, come on. I want this to... Okay, great. Well, good morning, and I'd like to thank the alumni, our alumni group, for inviting me to speak. It's a pleasure to tell you the story of our heroic alumni who worked over 100 years ago, and hopefully it'll give us a perspective and a beacon of hope today during these difficult times. So let's begin. Before you is the picture, as you probably all know, is May in Wells Hall. And Wells Hall was significant, as you will see in my story. So 100 years ago, the professors, teachers, and alumni at our normal school in Framingham were fighting wars at many fronts. There was World War I, the wars against two major diseases, tuberculosis and the 1918 influenza pandemic, and the right of women to vote. It was before protective programs like minimum wage, Social Security, unemployment insurance, and health insurance. At a time, insurance policies were mainly life insurance policies for burial expenses. So most people were treated in their homes because they could not afford hospitalizations. Oh. Is there a way to fix this so you can see the right side, Francesca?
What
Well,
do you mean?
hopefully. What's that?
Which?
Well, I think that'll probably be okay. I think most of the pictures will be, that's ran into this once before. I don't know. Well, anyway, let's go on. This is a picture of Irving Square in Framingham around the turn of the century. In 1917, life expectancy was 48 years for men and 54 for women. Life-threatening infectious diseases were common, like diphtheria, typhoid fever, scarlet fever, meningitis, tuberculosis, and polio. Many children died before the ages of 5. And it was before most vaccines were available and antibacterial medication and antiviral medication was discovered. Tuberculosis was the leading cause of death and disability, and it was feared because many times patients either died or were sent for years and sometimes never returned from sanatoriums where they were isolated from their families and community. So most of the patients did not seek medical care until they were very, very, very sick into the advanced stages of the disease, which made it very difficult to cure. And since it was before anti-tuberculosis therapy, the treatments we had available essentially was fresh air, good diet, rest, and some surgical interventions. They were removing sections of the lung that were affected by the disease. That was all they had. So what they did is they wanted to be able to control it in Metropolitan Life Insurance, along with the National Tuberculosis Association, and Lillian Wall, the mother of public health nursing, who implemented the program along with the National Tuberculosis Association, a program, and they used Framingham because it was a typical town. And they formed the Framingham Health and Tuberculosis Demonstration. And the idea was to test their theories in a community. So it was done here. At the very beginning, all of the households were canvassed to look for diseases. And essentially, everybody was offered a free exam in the town. And the town they actually did 14,000 exams. 82% of the population in the town actually had a physical exam in 1917, the year before the pandemic. And the college was very active in this demonstration. And one of the things they did is they processed all the laboratory work. So the picture on the left here is the picture of the laboratory where they're actually doing the work. And this is Wells Hall, where they had the laboratories, and on the right is another picture of the lab as well. But they had 18 workers from the school that processed all of the lab work for the exam week. So they were pretty busy. Another area that the normal school was involved is the teachers taught at the Civic Center, and part of the program was to teach childcare, worker safety, sanitation, and disease prevention. It was really critical to educate the public on disease prevention and how to prevent transmission and how to protect yourself from transmission. So if you're beginning to hear a lot of what we're using today during coronavirus, we learned in 1917, 18 from Framingham and also from the 1918 flu. They also had weekly newsletters in the newspapers that updated everybody on what the demonstration was doing, what to expect, and seasonally how to protect themselves. It would be from the flu or mosquito bites, depending on what was happening at the time. Now, one of the things they found is several children inside the schools, and of course, TB was so prevalent back then, this is not uncommon, actually had tuberculosis, 11% of them. And 33% of the children were actually infected, at risk of developing tuberculosis. So another part of the program was to develop the open air school where the windows were open and seating was well spaced. And does this not sound familiar to what we're hearing today? Go outside, have open air, and have some distance between people around you. So the end result of this is we found that okay, can you see my little mouse? Anyway, the iceberg is a great analysis for outbreak control, because typically what we see is the tip of the iceberg. But what we have to do to control the disease is find out what is going on underneath. And this is where contact tracing comes in hand. This is where actually having people understand it's important to report if you've been in contact with someone. And this is how we're able to actually stop the diseases, by finding out where it's being spread. So as you can see back then, we had very little understanding before this demonstration of what was going on in the community. We only knew a very small percentage of the cases. As a result of this demonstration, though, they were able to decrease tuberculosis by 55% and the death rate from tuberculosis by 68% in the town Framingham. And one of the ways they did that is, first of all, they instructed people to come in. They had the exam week. So they went out and looked for cases. And that's called active case investigation. And then they continued to do this, and they instructed people, if they knew someone in their household that was developing symptoms, contact tracing, to, let the nurses know. The other thing they did, so they reduced the death rate by 68%, but they increased the early diagnosis of the disease from 45 to 75%, which was really critical, because the earlier you got the disease diagnosed and the less severe it was, the more likely you were able to cure the disease. Dr. Comstock actually called this, he called this, he's a well-known TB expert. He called the Framingham demonstration the crown jewel of the Metropolitan Health Projects, Metropolitan Life Health Projects. And the demonstration created a model that sparked an era of public health, community, infectious disease control, and investigation. And using a population base seeking predisposing factors leading to other chronic diseases, such as cancer. So we now have a model that we could use to investigate diseases, and it was adopted across the United States, Canada, and Europe. And we were watched very closely. Framingham was watched all over the world when this program was going on, because TB was such a debilitating disease and so common and such a terrible pandemic. And it paved the way for the Framingham Heart Study. That's why Framingham got the Heart Study, because this original study was done. Now, in the midst of the demonstration, we had the 1918 influenza pandemic that occurred, and the virus infected roughly 500 million people worldwide, 1/3 of the world population, and caused 50 million deaths worldwide. In the United States, 25% of the population caught the virus, and we had 650,000 die. Like today's coronavirus, the flu pandemic created a major public health emergency. There were shortages of hospital beds. There was a need for field hospitals, shortages of doctors and nurses, because many of them had been drafted into the war. And then some of them also became sick, like we're witnessing today with the coronavirus, from the influenza, and unable to work. And routine health visits in clinics were suspended, much like what we're seeing today when the hospitals got overwhelmed. There was no vaccine to protect against the virus, so people were urged to isolate, quarantine, practice good personal hygiene, limit social interactions. All gathering places like schools, churches, theaters, dance halls, bars, and bowling alleys were forced to close in the town. Additionally, there was a major outbreak on the wharfs in Boston. And so 3,000 sailors were sent to Muster Field in Framingham to isolate them from the outbreaks. And it was really difficult when the outbreaks hit the military because they lived in crowded barracks. So transmission was very easy. It turned out by removing these 3,000 sailors to Framingham, nobody in that group actually developed the flu. So it was quite effective. Now, the other thing is the townspeople were very actively involved in helping, much like what we're seeing today with coronavirus, people making masks and doing various things. So they joined in the struggle and they donated bedding to the hospital. And they used the kitchen in the high school in Framingham and also the kitchens at the college because the college was closed. So they used these kitchens to prepare food for the hospitals that were overwhelmed and for the poor in the community. And also teachers were out of school because the schools were closed and they volunteered and worked in the hospitals to help the nurses shortage. Now the town peoples were well informed because they had already been, the public health officials and public health nurses and doctors had already been in their home talking with them, explaining about disease control. And I'm sure if you were walking down the street today in Framingham and you asked someone, what should you do to prevent transmission of the flu? They would be quite well informed because they had been this major health campaign. So they were informed. There were frequent messages that were going out on how to protect themselves that were put in the newspaper and go out into the sunshine, they were told. Many of us were told, what are you doing inside by our parents? Go outside. A lot of this came from disease control, from the Framingham Project and from the influenza. So those who were sick were monitored very closely at home and told to remain home unless they were too sick, they'd bring them into the hospitals. Town people were told to go outside. There were frequent health letters. And like Framingham, many towns and cities across the United States with the lowest death rates from the flu had the lowest death rates because they actually followed the advice of the public health officials. And those that had the highest death rates, one that stands out is Philadelphia, that had a parade of 200,000 people, had very, very, very high death rates. And their system became overwhelmed, so much so that their morgues were overwhelmed, the hospitals were overwhelmed, and they were bodies in the streets. It was pretty harsh. Now, I talked to you a little bit about the iceberg and what we found in 1918 and in the tuberculosis pandemic. And it's very effective in understanding what's going on today. So we all know that we had a biotechnology conference in Boston that really started a lot of the outbreaks in a lot of the towns around the Boston area. Initially, there were 100 cases. And to this date, it's estimated that there were 20,000 in Massachusetts alone. There was one instance where a mother or a father, a parent got a corona. The child got it, went to school, infected the bus driver, everybody on the bus, the school nurse, the teachers, and the school had to be shut down. And this happened in several towns, Hopkinton, Wellesley. So this is in a real live example of how quickly a very infectious airborne organism can spread, like coronavirus and tuberculosis. And they believe that this conference, as a result of it, they not only spread to Massachusetts, but there were people here from around the world. So there were little outbreaks as a result of it in Virginia, North Carolina, New Jersey, Iowa, Tennessee, and also Australia, Sweden, Italy, Germany, and Switzerland, and Slovakia. So this is how you end up having a pandemic that spreads so quickly. And today it spreads even faster than it did 100 years ago because we're so mobile. We can be on the plane and across the planet in a matter of hours or across the country. So this is what's happening today. And just a little plug. This is what they call the Swiss cheese model. And it gives you an idea of the organism and how it goes. It can go through the Swiss cheese, but if you put protective measures in place, the cloth mask, as you can see, if we wear a mask, it really does greatly diminish the impact of the organism transmission. And this is to you, and if you happen to have it, you're less likely to spread it to people around you if you have a mask. And then social distancing, again, adds another wall to protect. And then, you know, the cleaning and disinfecting, which is a little smaller area of transmission, but still significant. And if you do all of these three things, you basically wash your hands, you basically can prevent the spread to you or to people around you. Now, at the end of all of this, it's important for us to reflect during these tough times that we had in the past of our alumni and what they did. In 19th century, Framingham School graduates became teachers, principals, professors, doctors, lawyers, poets, and writers, and they participated in the normal school. Women participated in the suffragette, the temperance movement, and many significant educational and social programs at the time. And Ellen Hyde, class of 1862, taught in the school, in the Framingham Normal School until 1875, and then became its principal in 1898. She was an inspiring teacher and a builder of character in her pupils, and she established the Ellen Hyde Fund in 1898, knowing how difficult a lot of her students struggled to pay their way through school. This is a fund that we have that we award to the students today to help them so they can afford their education. And Amelia Davis, class of 1864, she taught at the college as well for 46 years. And she and her colleagues began to subsidize their colleagues that became incapacitated and could no longer work and needed financial assistance. Back then, that we didn't have programs that we have today. So if you could not work, you did not have an income, essentially. So a fund was established in 1910 by the class of 1892 in her honor. And her humanitarian shines out in the statement that she makes: "My heart is full. The list of your names brings you near, very near to me. You have changed the remaining years of my life, not only by the beautiful journey which you have made possible for me, but also by the loving hearts which you have shown." And then Olivia Davis, class of 1881, was a nurse and an educator, and she co-founded the Tuskegee Institute in Alabama with her husband, Booker T. Washington. In 1886, she delivered a speech to the Alabama State Teachers Association on the subject of how shall we make the women of our race stronger, where she asserted that the African-American girls were the hope of the race, and that the road to collective improvement of the African-Americans depended on the development of its daughters. So these are, I think, will help maybe give us some hope that we've been through some difficult times before, and people have come together, we've gone through it, we've become better people as a result of it. And I think now what we'd like to do is have a discussion period where we can share our experiences of what's going on today and maybe relate it back to, and I'll stop sharing, right, Francesca? Probably.
Sure.
So we can have a discussion. Okay.
So welcome to unmute.
I'm eating my breakfast, sorry. But I have a question, so bear with me. Kathy, this certainly is about COVID, but can you explain this 15-minute thing because I've heard so many different explanations about, when you're near someone for more than 15 minutes, you're at risk. And then it was explained differently. So could you clarify that?
Well, what they have, okay, if you are near someone that has COVID, it's an airborne transmission. So you are at risk. But what they have found, essentially, it seems to be sustained for 16 minutes is what is more than likely. So a brief, you're seeing someone for a very brief period of time, you have less risk. That does not mean it's totally zero, but it's a lot less. It's like the Swiss cheese. The mask greatly reduces the transmission of the organism. So the briefer your period and the more distant you are, and if you have a mask, that really does greatly reduce your risk. The longer you're with someone that's infected and the closer you are, and if you don't have a mask, that increases your risk. And almost if you don't have a mask and you're close to someone with tuberculosis, because it's airborne, you're probably going to get infected because it's very infectious. All you have to do is breathe in the organisms. Just another caveat, the people who wear their mask down, essentially the nose is your main inhaler into your GI, your respiratory tract. So by not covering your nose, you're leaving yourself wide open. It's a little bit like, I closed the window but left the front door open, for the organism. So you're not doing yourself much service by doing that. So you want the mask to be tight around your nose, in your mouth. And so the reason being is you inhale into your respiratory tract, it goes into your lungs and begins to multiply. The tighter the mask is around your face, the less likely those microscopic, because they're microscopic organisms, can get in and around. The other thing they have found too is there's less transmission if you're wearing glasses or protective eye gear. It's not as frequently seen as it is as far as respiratory goes, but there have been incidences where the organism has entered via the eye, an infection in the eye. So if you're going to go into a place like a grocery store, I would mask up and have, definitely have eyeglasses on, or some sort of eye protection, because you're now in an area where there's a very, very high risk with multiple people coming in all the time. And what happens is the more the person that's infected is in an area, the more organisms are dispensed in that given area. So if you're in a small elevator, for instance, and someone has COVID, you are much more likely to inhale the organism because it's a confined and closed area and it's in a small space than you would be in a very large area. And clearly a lot less likely if you're outside. But that's how it goes. But in a place like grocery stores, we know there's been transmission in the grocery stores and stores. And that being, there's just so many people in the air, and are they really transferring that air and circulating that air? Maybe not, in order to save for air conditioning and heat, they don't circulate their air like on planes for as much as we would like to stop these sort of things. Did that help?
Oh, yeah. I had heard conflicting things that someone said, well, if I'm 5 minutes next to this person and I go away for a few minutes, do I have 10 minutes left or do I start my 15 again? And so I think that's the confusion
Yes,
But thank you. Can I raise one more question?
sure.
Thank you. I've heard many people, I've been tested. So today, well, last week, I'm good, right? I've heard people say, well, I got tested, but tomorrow I could be exposed again. So I think it deters people from going, some people from going to get tested because they feel as though, yeah, that day I was good, but I went to the grocery store the next day. So does that mean I have to test again? So I think I will always get tested for sure, just being a nurse, but I just feel like a lot of people won't because of that issue, because it's iffy. Do you have any thoughts on that?
Well, yes, if you're looking at it from a big picture perspective, the more that you can capture while they are infectious, to bring them away from the community and quarantine them, the better you get a handle and you're reducing the disease from transmitting and spreading throughout the community. The bottom line is if you're tested and you would, let's say I was exposed to you, Annie, and it was 3 days ago, and I got tested today. It's conceivable the organisms could be working in my body and I'm not sick yet. I could be sick in 3 hours. So yes, the test is a split second in time, but it is a valuable tool for the public health people to know where the outbreaks are going on in the town, so they can go in and maybe work with that community a little bit better and maybe do more in detail testing so they can remove that section and stop the outbreak. But the bottom line is we have to always practice those rules of wear a mask, consider everybody infectious except your own immediate household, unless they went somewhere,
Yeah.
because they're actually saying in some households, they should be, some individuals, if they're out a lot and there's someone at risk within the household, they should be sleeping in different quarters and things like that. So, but that's like in isolated situations. So the big thing is if you practice, you wear your mask, you distance from people, you consider everybody around you could possibly be infected, not know it, which is the thing that makes this more difficult to control. When you have tuberculosis, you know it. When you have the flu, you know it. When you have corona, you might not know it. So it's 40% are asymptomatic, but yet are infectious. So that's the key is just practice that and do the best you can. And, at the end of the day, if something happens, at least you did your best. That's a piece of it all too. So, and it does work, because in the states where they don't have mask mandates, they are now dealing with some real serious issues. And it's in areas that you wouldn't expect. The Dakotas, not a lot of people there, Idaho, Minnesota, Wyoming. I was talking to a group in Wyoming actually at the beginning of all of this, and they said, well, we're so rural, we don't think anything will happen. Well, it will spread everywhere. And so does that help?
Yeah, thank you.
Okay.
More questions? I actually have, going back to testing, I have
Yes.
one test because I knew that I was going to be seeing people that might be highly vulnerable in 2 days. So I got a test 2
Yes.
days before, hoping I would get the result in 24 hours, and then I would see them on the next day. So I tried to keep it close.
Mhm.
And that's been the only test that I've gotten. And I was negative, so it all worked out. But when do you need, I mean, when do you need to get tested? Was that decent reasoning? Or should people who are going to work often with the public be getting tested weekly? That sort of thing.
Well, of course, healthcare workers are frequently tested. And some of the colleges have weekly tests.
Here.
Weekly, yeah. As far as, if you're dealing with a vulnerable population, so there would be a recommendation that you would be, tested to make sure. But again, if you use the mask and the distance and all of that. The other thing is if you are cited, actually, they have an app in Framingham, I guess, that you can sign up and they'll tell you whether you were exposed. It's kind of interesting. They're doing that around the world. And so it's a way to notify people and then ask them to get tested. But from the public health perspective, what we're looking for are people that have been exposed, that we know are exposed, and people that are positive. And then as soon as we can get their contacts, then we can shut that cluster down. That's kind of what the focus is. So, but I know that Framingham wants you to get tested as often as possible. So if you're out and you're working with vulnerable populations, they have a big incentive for you to do that. And I think they are looking at it as a preventive measure. But they're also, I heard, the testing model is going to be used for dispensing the vaccine. So they're learning ways of testing and pushing large numbers of people through. And that model is going to be used to give everybody, because the dispensing of the vaccine is going to be absolutely phenomenal. So,
Kat,
yes.
how do you feel about the new home test that's just coming out? And they're just talking about you can test at home and get the results in 30 minutes. So if that comes to fruition, say I test and then I'm positive, what do I do? Call my doctor and say, hey, guess what?
Yes, you want to let your doctor know, and then the doctor will report it. It wouldn't hurt to let the health department know, and they can direct you. One of the nurses there they have 12 of them now instead of 2, working on this whole thing. And one of them can give you instructions as to how, to notify people, and they can help do that. If there's some patients, they don't like to let people, there's a stigma with some of these things, and they don't really want to let people know themselves, and they don't want people to know where they got it. So the health department can be the person there that would just say, you were at such and such a place, or have been in contact. We know that, and they can keep your confidentiality for you. Is there another part of that question? Did I answer it?
Yeah, you did. And do you think it's reliable, or it's going to be reliable?
Oh, I'm sorry. Okay. The quick tests a lot of times are not, that accurate. So, classic is the quick test that they have in the White House didn't seem to work out very well. So I think there's, the key with these, and from a nursing perspective, and those of the nurses on the call will understand this, is how it's done. So there was one testing area, and it was in Rhode Island actually, and they were doing a lot of tests, and 2 people that I know actually had corona, a child and a mother, and the pediatric practice did an analysis and found that 40% of the children that had negative corona tests actually had corona. And the reason is you're supposed to take swabs of both nostrils, and a lot of times they only did one. Or from a nursing perspective, I can tell you having something go up your nose is very uncomfortable, and to do it right, it's really uncomfortable. So a lot of times it's how the test is done. So to get back to the home, if you're not doing it, really very well, which is possible, and if you have a test that is not really high in accuracy, then I wonder about how good it will be in that way, because one of the dilemmas is if you get a false negative, you have a false sense of security and may take risks. And that's what begins to happen. So the home test may be an advancement, but the thing to look at is how accurate it is and what you have to do yourself to keep that accuracy. Just touching a little bit of your nose won't work if you're supposed to really stick it up there, that sort of thing. And you're supposed to do it too.
Yeah, I'm curious if people at home who test positive notify their physician. I wonder if they'll retest them themselves just to be sure.
If the test is typically, that's what we do, is if we do retest, and we might send you to a more accurate facility, because the other thing that happens with some of these is you also get false positives where you think you have COVID and you actually don't. So the key is an advancement. Some of the doctors think it's good, but that's going to be that gray area of, is it administered okay, and what's the accuracy? And what does it do to people to maybe give them a false sense of security, or that would be the biggest danger, I think. Or having them think that they're okay and they're not, and they're out.
And I'll just stay home again.
Well, it's a difficult situation in that, it's so infectious, and it can be so dangerous, and we don't know to who. There are some very young people and young children that have now chronic conditions as a result of it, and they were healthy. There are couples that, one partner had a comorbidity and the other one didn't, and the one that didn't is the one that died. And so there's no predictors. So it's just better, I think, to take extra precautions and to prevent the spread, because when the spread gets out of control, your infrastructure starts to fall apart. What we're seeing is in, the Dakotas, that now people are being airlifted out of the state, for heaven's sakes. I mean, imagine in Idaho, you're in the state of Washington, or they're being sent to a hospital 500 miles away, because they're running out of beds, vents and personnel. And the personnel are getting burnt out. It's a different kind of burnout. It's burnt out with your social infrastructure. You can still go on vacation. It's a different kind of burnout than today. So if the system gets overburdened, things not only hurts the economy, but things that we depend on are no longer there. Like food isn't going to get delivered, and maybe now they have in some of these places the funeral homes are overwhelmed, so they have morgue trucks, refrigerator trucks, and things like that, and that's kind of scary for the population to see.
Kathy, my name's Joan Hill. I live in Natick, class of, I got to figure out when, it's 1977. Nutrition background. So I am in the healthcare field. I'm curious about the dilemma that I'm dealing with, which is personally, I have a 94-year-old mother-in-law who lives in Framingham and is totally isolated. We do
Yes.
drop off food. We ourselves personally were quarantining because we were expecting a grandchild, which was successfully delivered, thank God.
Oh, good. Yeah.
With a minor complication with the mom, but now she's feeling better. But now we're, been exposed to that side of the family. They have a 3.5-year-old grandson who had been going to daycare. And so now he's back in the family. We just went and saw them. And now my mother-in-law. So I'm like torn between how do I help on both ends? I got a daughter-in-law who's not well post-delivery and a 94-year-old mother-in-law who needs exposure to people. I'm struggling. Got to figure out how to help them both.
Yes, that is true. And actually, the alumni group, we've been talking about having more of these Zoom meetings to get, just for the socialization, because we know that people are isolated. Maybe we could have a mother and student, or mother and alumni. Maybe we could have one of these things where, if you do have a parent that you're taking care of, we could have some discussion and get both of them on. I don't know, but it is a concern. You can safely do things outside. I visited my granddaughter a couple weeks ago and we played outside, and she had a mask and I had a mask, and we still, had some distance between us. But I guess you get back to, nurses and doctors wear HEPA filters and they have protective gear and they can protect themselves. So I guess what I would do is, if I have to go into both of those homes, I would have all of the gear I could have on to go visit my daughter-in-law, and similarly to go visit, my mother. So you're doing all you possibly can. And, maybe having something, as a matter of fact, I saw a picture, it was really adorable. It was a 103-year-old woman, and she was like almost in a hazmat suit. She had everything on you could possibly, so she could vote. And go
Good
to
for
the
her.
mailbox, pop something in. But outside, I noticed, it's, of course, we're getting into a bad season. It's cold again, but I noticed that some people, they have their chairs outside in their yard and they're like 6 feet apart and they gather. And that would be, safe enough. If your mother had a mask, you could see some of her friends, but, in an outside environment.
Would you recommend the gals that are coming in to do her house cleaning and she has somebody come in a couple of days a week to help with bathing her? Would you recommend that and these are people that she's hired, they're not through an agency. Would you recommend that they be tested? I'm concerned. I'm, just listening to you talk now. I doubt that they've tested themselves.
Yes. If they're wearing, again, protective gear, but of course, washing her and all of that. The advantage to an agency is they're probably
testing.
Providing.
One would hope they're testing.
And testing and keeping track of those things. Whereas the individual, that means it falls on your shoulders of maybe having them, asking them to get tested and finding out where they are. I'd like to know where they are.
Yeah. So one lives in Holliston and the other gal lives in Framingham.
Yeah. And where that's a dilemma with cleaning, you can both wear masks and I guess the other thing to do
I
is
tell her to go in the other room. Like when the girl who comes to clean, I said, you don't need to be looking over her shoulder if she's tucking in the bed correctly. Go into the den and stay away from her.
Yeah.
And
That-
certainly
and-
wash
and
her
the
hands
other-
after she's gone.
And then the other thing you can do is you can open the windows and totally air out the whole house, and
Oh.
that will help, you
Okay.
know. I do that myself.
Uh-huh.
When people come, I have the windows open and they don't mind. You know, so
Okay.
that's one thing. And then when
Thank you.
she's getting bathed, it's a little harder to open the window when it's 20 out.
Sure.
But I mean, I just kind of make sure that this woman was very, very
Wearing
well
a mask.
protected.
Mhm.
Yeah, and maybe, you know, glasses and, you know, and that's about all you can do.
Mhm.
Yeah. But if you can convince them to get tested, it would be helpful.
I'll ask my mother-in-law. I don't know if she's even bothered to ask.
Can I
Yeah.
big question, Kathy? So I talked to my doctor, you know, way back, you know, probably in March or April, about people coming in my house to help with my mother. And she suggested that, you know, it couldn't hurt to get a instant read thermometer, you know, one of the ones that you just point.
Oh, that's true. Yeah.
Is that still recommended? Because I know that it's changed. You know, like I also another question I had is, are gloves worth it at all? Because
Mhm.
the recommendations on that changed.
The gloves, the thermometer, they're saying it doesn't always pick things up, but it's one added thing. But from another perspective too, I'll just digress 1 second. They're also recommending oxygen readers for people that are older, because then what you can do is you can, actually I have one, you can assess the status of yourself and the person that might have it. And by looking at their oxygen reading, you know, you can tell if they should be admitted to the hospital. So that some people are recommending that.
Oh,
So that's why they, you know, but
so like if I kept a running, like did a daily oxygen read, which I have had to do for my mother in the past, but she hasn't needed it lately. But if I did a daily read, then I could see if it went down pretty.
you can see if it went down, and also you're going to get a regular running count. So
Yeah.
you're going to, so instead of, yeah, I mean, if she's running at a you know, lower 90s, and then she gets sick, you're going to know that's what she's been running. So you get this constant reading. So that would be beneficial. As far as, you know, I mean, as far as is the temperature, again, it's just one more added, you know, way of picking things up. It isn't a guarantee, you know, enough, you know, it isn't a guarantee that you're going to pick up the non-symptomatic.
Right.
As far as the gloves go, yes, the gloves can be beneficial. The thing with the gloves is you have to be careful. You have to remember when you wear them, they're contaminated when you take them off. And there's a special way that us nurses, you know, we basically, if you can see, you put your finger in and flip it back. So you touch the inside and not the outside when you throw it away. Or if you do touch the outside, really wash your hands. But for someone coming in and taking care of your loved one, then, you know, having them wearing the gloves would be beneficial. It would be one more added, as many barriers as you can put up, you know, you can put up, try to put up. So the thermometer isn't a guarantee, but it's one more barrier again that you're using. And in opening windows is another barrier, and the mask is another barrier, and glasses is another barrier. So that's the way to kind of look at things. And as far as surfaces and everything, it isn't quite the transmission that we thought at the very beginning, but it is a little bit there. But washing your hands, I think they also have, I saw someone that has, there's a spray, a 90% spray, but you could spray surfaces if you wanted. But if you leave, like if someone's doing something and you leave the area where they're working that are inside the house and don't go in it for a few hours, that again is another way to eliminate your risk. So it'll be nice when we get that darn vaccine, won't it? Yeah.
Amen to that
Oh my gosh, well, thank you so much. I have to leave, but this
as
is
well.
wonderful. Before I go though, I'm a librarian and there's a book that I'm going to recommend to you, and it's called The Pulling of the Stars by Emma Donoghue.
Yeah.
And it takes place in Ireland, 1918. And it's very well written. And the heroine is a nurse in a hospital, and she's working with maternity patients. And if you read this book, you just kind of wonder how any of them made it through, because obviously they didn't have the medicines and the concepts that we have. I mean, they thought that, you know, if you had this flu and you had a temperature, they gave them whiskey.
Yeah.
But I have to tell you, it is very well written, and it's just a good read about 1918. And she
That's great.
researched this before COVID ever happened.
Oh, okay. And what is
So
her
if you want a
name again?
good read, I recommend that. The Pull, Pull of the Stars. And the author, she's Irish, Emma Donoghue.
Okay.
She also wrote The Room, if anybody read The Room, but it's really very well written, and it just gives you an eye opener as to what was happening in Ireland at the time.
At the time, yeah.
Yeah,
Yeah.
very, very well written.
I have to go
Thank
as
you.
well. Thank you so much
Thank
for
you so
your
much.
presentation,
Maybe
Kathleen.
that would be, maybe that'd be a nice presentation, books that
Yeah, I
people
mean,
would
really,
read.
I highly recommend it. Thank you again.
Yeah.
It's lovely seeing you all.
Thank you.
Thank you.
So it's funny that was the book. I just requested it for an alum,
No kidding. Yeah.
Framingham State Library, because they were the only ones with a copy left.
Wow.
So it's a very popular book right now.
Yeah.
Wow.
Book clubs are reading it, apparently.
Yeah, so I wanted to share getting tested, because I got tested a lot because we go to Maine and that was a requirement.
Oh, yes. Sure.
Well, one thing is I endured the lineup 3.5 hours, but then I discovered that some towns and places you just make an appointment, and that was so easy. So I'm thinking some people don't want to do the test because they see the lines, they read about the lines, and you don't have to go. I think people don't realize you don't have to go in the town where you live, because all my tests were in Marlborough.
Oh, okay.
But were
And,
they still free, or did they?
Yes, they were free. They're open to anybody in Massachusetts. I think that's something that's not well known. I was delighted to find that out after the first time where I went to the Marlborough Hospital, and I had the saliva test. But the other ones was through something family care, urgent care in Marlborough. And again, it was offered free. I mean, they have the paid as well, but you just click on you do it all online. You just click on you want it free, and then you pick the date and the time, and you drive up, and I was in and out in 10 minutes. It was really easy, and then you get the results online within 24 or 48 hours.
That's great. That's
Yeah.
very helpful. Yeah. I have one friend that was in 4 hours in a line. Yeah.
Oh yeah, well, I saw the other day on Speen Street, there's because the testings at TJX, and there was a huge backup up Speen Street and then around the corner on Route 30, going towards Wayland. Huge, it was huge. I couldn't believe they didn't have police out there directing because it was really causing a big tie-up. And that was on Saturday. Ugh, it was awful. I saw it as I was coming down Speen Street from Home Depot, and then I just took a left instead of trying to go straight. Yeah. But anyway, share that if people are reluctant to go get tested too. If they go
Yes,
online on this site, yeah, find a place that can do that.
Well,
yeah, that's great. It's good we have so much available testing, but the demand must tremendously increase to get these backups.
well, our time is just about up. So folks who are still with us, I hope you'll look at the chat. There are a few links there to the events I was talking about. And
I'm not seeing them. I'm not, and I see your post about I live with my 91-year-old mother, but
really, I wonder if it was because you guys, I posted them before you came on. I don't know.
I see them.
You see them?
you see them?
I just answered you, Francesca.
You did.
About the 91-year-old woman, I see the face shield, right? But I
Yeah,
don't
the face shield.
see
Yeah.
links. I don't see links though.
I just posted. them.
There, now I
Oh,
see
there you
them.
go.
Okay.
Maybe because I put them up before you guys logged in.
That could be.
That's weird. That's a
Yeah, I don't know a whole lot about
yeah.
Zoom, but that could be it. Every time I do one of these, I learn something new.
yeah.
Jessica, when did the cards start, the writing? When does that start?
The first week of December.
Okay.
So
They're
And
thinking
do
of
you
having
want
a
us-
Zoom meeting too, aren't we? Thinking of zooming in while we're during one of the.
I think a few people have an interest in that. So after we get distributed, we'll probably plan a day. But I
Are
don't know
we,
when we'll get them out yet.
are we coming to you to get them?
Yes, hopefully, if you're able. So we'll try to arrange with people pickup times and leave them on the front porch, similar to how the library does stuff. We'll bag them up with people's names on them. And if people want to pick them up, for some people, they would rather have them delivered. So we are asking for volunteers for local delivery. And I actually had one woman who lives far away offered to pay for shipping to have them shipped to her, which was, I just thought, really nice. So that is an option for some folks who really want to participate, but live far away, is we'll try to mail some envelopes out. So,
Okay.
but please let us know. Please use the link so that I can kind of figure out who's available. But we don't have the cards yet, so that's why, unfortunately, my timing wasn't early enough to get things going early. So it's going to be the last minute. Get them out that first week of December.
Oh,
Blame
it's all
it
right.
all on COVID.
I'm
That's all.
all about that.
Yeah, it's all COVID's fault. Kathy, thank you. This was great.
Oh, anytime, Annie. If you have any questions, just give me a call.
I
Yeah.
will.
I'm actually working with Al now, so I some insight.
good.
Yeah.
Good, great.
So, yeah.
All right.
All right. Well, thank you, everyone.
Okay. Thank
Hope
you.
to see you
Yeah.
soon.
Thank you
Bye,
for
kids.
the
Bye, kids.